Some of the stark images we've seen during the pandemic are those of hospitals loaded with patients being treated for the coronavirus. This during an election year when health care is the most important issue to a lot of voters. And it figures prominently in Iowa's race for U.S. Senate as well. Back to my conversation with Kimberly Graham. I want to get back to some of the issues in your campaign and combine it with this pandemic issue. And you touched on the Medicare for All stance a moment ago, but we know that's proven to be a tough sell, certainly at least on the lawmaker front, and certainly with a lot of people when they question about whether or not to keep their current health care. They like their system if they're funded by their employers. Why do you and the people who agree with you think that this pandemic supports your case?
Well, the most notable one is for so many people, healthcare is tied to their job. And now so many people don't have jobs. And so now they don't have healthcare. And it just shouldn't be that way. I mean, that's one of those things that should we not have the votes in the US Senate to come to a Medicare for all or universal single payer, that is at least something we've got to get to where your insurance is not so often tied to your job. I realize that you can go into the government plans and purchase it separately right now, but that also presents a lot of problems because as you'll notice, I just said the word purchase. And so, healthcare in a moral and wealthy nation should work a lot like going to a public library. We have decided in this nation that we value a library. We want libraries, so we have public libraries. And we all pay for those public libraries. And they're not free. You're never gonna hear me say free healthcare, free college. I don't say that because they're not free, right? They're just not. And so, but we all decide we're gonna chip in and pay for the library. And we're all gonna chip in and pay the librarian's salary. And we're gonna chip in and pay for all those books. And then when we go to the library, we hand them our card, we get a book, and we leave. We don't hand them a debit card, we don't write a check, and we don't get a bill in the mail. And that is how healthcare should work in a moral and wealthy nation. I have some friends in Canada, and their jaws always drop whenever they hear about stories about people going to the ER. Oh, my kid broke their leg. Oh, our deductible's $5,000. So now we've got a $5,000 hole we got to try to dig out of. Their kid breaks their leg in Canada, they go get it fixed, and that's that. They don't end up with a $5,000 bill coming to their home that they, and that's just their portion that the insurance didn't pay, that they now need to dig out of. And that's part of the reason why in the lower and middle income people in this country can never get ahead, is all of our medical deductibles and co-pays and co-insurance and premiums. So having a universal single payer system where we all chip in, and then that's just something we have because we live in the United States of America, that would really help so many people. And it would also boost entrepreneurship. Small businesses who attempt to provide healthcare to their employees are crippled by the costs that they pay, their portion of those costs. We're losing companies to Canada because they're going across the border to Canada, moving their operations to Canada. Why? Because then that company no longer has to deal with all the medical insurance costs and a new plan every year and increases every year and all of that.
Can private insurance still exist under your ideas?
Well, I don't know why it would as far as medical. I mean, certainly I have no personal problem with somebody wanting to pay for something like that if they want to. I don't know why they would. I mean, that typically isn't necessary under the kind of plan that I'm talking about. But I don't have any particular interest in making private insurance illegal. It just would no longer be necessary.
Obviously, it would depend if they could compete. Higher reimbursement rates for doctors under a Medicare for All system is arguably crucial to keep them in the field, especially in rural areas, to make them want to come. How much higher do you think they have to be than what they get from Medicare now?
Yeah, I don't know how much higher. I mean, that's one of those granular things I would absolutely need to study. And if I was sitting in the US Senate and there was a bill in front of me, you better believe I would study it 10 ways to Sunday, because that's what I do. I'm a researcher and I love to know all the different angles and play everything out to its logical conclusion and see what the different paths, where they're gonna land us, right? And I do know that 18% of Iowa's rural hospitals are in grave danger of closing soon if something doesn't change. So in the short term, we've got to increase the reimbursement rates on the current version of Medicare, which is a different animal than Medicare for All that we're talking about. But under current Medicare, the issue becomes, for one thing, you know, Iowa has a lot of elders, disproportionately so to many other states. And then of those elders, even more of them disproportionately live in our rural areas. And so we have a lot of people using Medicare who go to rural hospitals. And that's part of the puzzle pieces in why rural hospitals are having such a hard time. There's a lot of reasons, that's not the only one, but we have got to drastically increase reimbursement rates for rural hospitals under any scenario, even under the scenario we're living in right now.
My conversation with Kimberly Graham. We couldn't fit all of it in here for you now this morning, but how she approaches climate and the military and web extras online for you at ourquadcities.com.